The anesthesiologist not only keeps you alive and makes sure that you're asleep during a surgery and comfortable and pain-free, they're watching every vital function of your body, your heart rate, your blood pressure, your oxygen level, and they're adjusting their anesthetic to maintain stability. There's no such thing as minor surgery when it's happening to you. So that's what's unique about anesthesia. We can take care of babies that are days old to 90-year-old patients. We have a broad spectrum of patients. We actually see everything. We see every specialty, and we see what everyone else is doing. So we have a foothold into all of the specialties in medicine, and that gives us a unique perspective. People often research their surgeon extensively. They go on the internet, they find out a lot about their surgeons, the medical procedure that they're having, the operation that they're having, but they often don't think about who's going to be their anesthesiologist, and the outcome of their surgery very much depends on the experience of the person who's taking care of you during the whole operation. But it's very important to know who's behind the scenes giving you the anesthetic. You want to make sure you have the most qualified person there who's done that anesthetic not once, not twice, but at least 1,000 times, taking care of you, so your outcome is absolutely perfect. You can ask your surgeon who their preferred anesthesiologist is, or who they would recommend for you to have anesthesia under, and they'll be happy to refer you. If you want to give them a call, meet with them beforehand, discuss your anesthetic, it's very much encouraged. I want people to be empowered. I want people to ask the right questions when they come for their operation or medical procedure. What kind of an anesthetic am I going to get? How long will it take me to recover? What am I going to get for pain relief afterwards? Well, if you've had any major health issues, if you have heart disease, diabetes, lung disease, if you're a heavy smoker, asthma, kidney disease, these are things that should be evaluated beforehand. All of the tests that are required have to be done before the day of surgery, because believe it or not, you can be all ready for your surgery, but the anesthesiologist can decide that you can't go through the surgery if certain tests are missing. Go through your anesthetic plan. Tell them any medical history that you have, if you have allergies, what special medications you're taking, how to control your diabetes and blood pressure beforehand so that your health is optimized. Best to stop smoking. If you can lose weight a few weeks before, make an effort to lose weight before surgery. All of these small adjustments make a big difference in your outcome. And once you speak to an anesthesiologist, what type of anesthesia are you going to get? Are you going to get sedation? Are you going to get a regional anesthetic like a spinal, an epidural, a nerve block? Are you going to be totally out and asleep with a general anesthetic? That's a good thing to learn this maybe a day or so beforehand, and it will relieve a lot of your anxiety about the surgery. And it's known that people who are less anxious wind up sometimes needing less medication and do very well. The anesthetic is geared to the population of patients. For infants and children, we have to take into account that they're not miniature adults. Dosing is very important in children and in infants. Heart, lung functions, body functions are not the same as the adult version until at least the age of 5. On the other extreme, we have the increasingly older population that are coming in for surgery, and older patients are more sensitive to anesthetics, so we have to adjust the dose accordingly. Yet another population are the increasingly heavier patient population that we encounter because obesity is a national health crisis. So we're modifying our equipment to accommodate the heavier patients so they can be safely anesthetized. The latest developments in drug research for anesthetic drugs are quick onset and quick offset. This allows patients to wake up faster, clear ahead, and return to their daily activities sooner and go about their daily lives and not have lingering effects. So nowadays, one of the biggest trends in anesthesia are regional blocks. So anesthesiologists are experts at the anatomy of the arm and the leg. So if you're having, let's say, knee surgery or ankle surgery, shoulder surgery or hand surgery, only that arm or leg needs to be numbed up. So a few drops of local anesthetic on particular nerves numbs up the area, and you can undergo surgery, recover faster, and go about your day. sooner. Being informed in your health care is part of taking care of yourself overall, just as you would go for a mammogram or a colonoscopy, just taking charge of who's going to take care of you and finding out some information about what that intervention is going to be. And an anesthetic is a serious intervention. It does give you a peace of mind, and it can help you with a better recovery from any medical procedure or surgery.